afternoon, and we have another episode of Rethink Healthcare. I'm one of your hosts, Wendy Ball, and your other host,
Paul Montenegro.
I'm just kidding.
Are you bipolar or something? Did you take your lithium today? I'm sorry. Did I offend you?
I can't believe you said that, Paul.
On camera?
That was just so mean.
Did I violate?
Oh my goodness, I'm gonna leave. Okay.
Take a deep breath.
What did you mean by that?
By what?
Exactly.
She's a good actress.
What are we talking about today? You guys are so lost.
Yeah,
but
I
we're
am.
not.
You got me lost too. Anyway, so when you wanted to talk about communication and working with your fellow professionals, right?
Yes, and even family or patients.
Yeah, so let's communication in general, but you know,
Yeah.
so then as we kind of prep for the episode, I said, well, why don't we kind of frame that instead of just communication, right? But let's taking it up to a whole different level of emotional quotient or emotional intelligence, right?
Yes.
So let's think through the process of communicating with the emotional quotient in mind. Does that make sense?
Yeah, that makes sense. Because we are, that's part of us as humans, right? We're physical, we are emotional, there's a lot to us than just, our physicalness. We get emotional on things.
Oh yeah.
Yeah.
So when you're communicating, whether it's communicating professionally or communicating to your patients, right? To whomever, right? To your family, to your spouse. Yeah? So think of how that communication will make that person feel, right? So I think that's one way, instead of kind of breaking through what emotional quotient is, right? Let's simplify it by thinking, okay, by me doing X or by me saying X or whatever action I do, what emotion will I possibly elicit to that other person?
And I think we know from our own personal experience, and we can't hypothesize every emotion that somebody's going to feel. And sometimes we might say something and never expect it to elicit that kind of emotion because we're all individuals and maybe there's something going on in that person's individual life.
Yeah.
But I think we've also felt when somebody has said something, we've also felt. So we know that it can elicit an emotional response.
Yeah.
And I think so we can put ourselves in that situation. So we want to be mindful of what we say, how we say it, and how somebody could take that or how they could react. And then on the other side, we want to make sure that when somebody says something to us, how do we react? Because there's two ways we can control things, as the sender and as the receiver. So
one of the things that I've always kind of kept in mind is people may not know what you did. People may not know the actions that you have done, right? But one thing that people always remember is how you made them feel.
yes.
Right? Because remember, we're emotional beings, right? So it doesn't matter what the action is, right? What's gonna stick in that person's mind is how did I feel with whatever you did?
Yeah, and I think that
So-
that even pulls into like our patients. How do we make our patients feel? Do we make our patients feel understood and validated when they have a problem? Because patients are going to come to you, or their family are going to come to you, and they might come at you because they're emotional, and they might come at you with like, this nurse did this or you did this, and how are you going to respond? How are you going to make them feel, right? Are you going to make them feel like, validated and that how they're feeling is important and you're concerned about getting to that resolution for them? Or are you going to make them feel like they're just dumb or it's not important or they're overreacting?
So let's look at it from our perspective as healthcare providers.
To each other?
Yeah.
Okay.
To our patient, right?
To our patient, okay.
Right? So in essence, you're automatically in some sort of level of control because they are the receiver of the care that you're giving.
Yes,
Whether
yes.
you're a doctor, nurse practitioner, nurse, or whoever, right?
And you're the professional too.
You're the
you have
provider.
Responsibility and accountability.
So one thing I always try and keep in mind is there's always that power difference in that relationship, right? Because you're the one with the information. You're the one who will act on at their time of need, because they're under your care because they're sick or they're ill or they have deficits that need assistance, right? Professional medical assistance. So think of it from that perspective, number one, right?
I like
so from the patient's perspective, right, you're automatically reliant on this person, right? But then what did that patient then lose, right? Number one, they don't have much control.
Yeah, they've lost a lot of control.
They've lost a lot of control, right? So a lot of times, right, if you want to be, if you want to be emotionally sensitive, you want to have a high EQ, emotional quotient, right, is to find ways to give some of that control back to them. And it doesn't have to be a big control, but involving them in the decision-making process. It could be, and mind you, right, this is it's a very, very simple thing that I usually do, right? When I was doing wound care or, whatever, primary care, and I need to apply something. Let's say I need to apply a Band-Aid. I might just ask him, hey, which way do you want the Band-Aid?
Yeah, giving them choices.
So that little thing, I'm giving a choice back. I'm giving them a level of control, how they want it. Obviously, all within reason. I mean, you're the medical professional. You decide, is it safe?
Yes.
But then, kind of involving them in that, right? So let's say I'm working with a patient where I'm trying to wean him off narcotics, right? It's very hard to do. But then I give them the choices. Okay, what do you think will be a better option? We got to pick something. So giving them a level of control within what's going to happen in those parameters.
Because control is one reason they might be responding in a way that may seem not appropriate or, over the top. What other things might cause the patient to respond in a way?
In emotional times, if there's emotional cases wherein, what if the patient is terminal?
Yeah.
Right?
Yeah, absolutely. They're dealing with a lot of emotions, maybe just being sick and then not being with family or a bad diagnosis or those type of things. So
so there are times that I may hold a little bit of information given the circumstance, being emotionally sensitive to what's happening.
So some empathy for them too.
Yeah,
empathy is super important in this.
Let's flip it now to communicating with your fellow professionals.
Ooh,
one of the things sometimes as I do my rounds, sometimes I will be encountering nurses doing med pass. I mean, I'm very sensitive to that. I try not to interrupt.
Yes.
In the middle.
Don't interrupt in the middle. They don't want to make an error.
There's a high error rate if you interrupt med pass. So if I see them in the middle, or I wait till they finish. They're not going to finish med pass. Med pass is a long period of time, but then I wait till they at least finish their thought process and then interject. Or I might just stand there, not interrupt them, and wait. I know that they had seen me and they know I'm waiting for them, but then I'm waiting. Basically, I'm letting them finish their thought process on what they have to do to then engage with me.
Yeah.
So that's that's a way of kind of engaging with your fellow professionals.
So my students, I think one of the fears when you are a nursing student and maybe a new grad and maybe even a little further on is actually having that communication with the physician or the provider, because either maybe you're scared or you maybe feel like you lack knowledge, or maybe, and we're all different and there's many wonderful physicians out there, but sometimes the physicians can get a little snappy with the nurses, and that has happened whether they're in a high emotional state because of something, they're overwhelmed, and just learning how to deal with that as a professional, because us snapping back to anybody else is not going to solve the problem, or us being afraid to communicate. That's always my fear with the nursing students, is no matter how a physician or somebody responds back to you, you still have to communicate with that provider, because you need to give good essential information, or you need to get information back or orders back, and we can't be afraid to push off that patient care because we don't want to talk to that physician, because I've had some snarky physicians. So how do you deal with that when you have...
Yeah, so here, I think I've had the benefit of being in both sides. I was a nursing aide, and I was a nurse, right? I'm a nurse practitioner, so I could play the role of being a provider, as a nurse practitioner, and also being a nurse, because before I became an NP, I was a nurse, right? So I know I was the one calling the physicians, right? So let's first think through the roles itself, right? So the nurse itself at the bedside, their responsibility is to assess the patient, gather information, right? And if there's anything abnormal, you report that to the physician, right? And as the physician, I'm not a physician, I'm a nurse practitioner. As a nurse practitioner, I gather that information and then make a cognitive assessment on what's going on to make a decision on what to do, right? So that's the context of it, right? Now, one of the things where it may be a bit off, and I just had this happen to me recently, actually, as of yesterday, right?
Okay.
Wherein the nurse was already giving me the treatment that they want. And I'm like, okay, I don't even know what's going on. You're already telling me what you want ordered. Well, that's not your role. That's not the nurse's job. You tell me what the issue is, and then let me process and figure out what to do. Right? But if they tell me, hey, can you order this for this patient? I'm like, well, Ron, I haven't even seen the patient. I have no information to go by. So we have to really understand our roles. And then as the nurse, if the nurse is communicating to the physician, make sure that what you're communicating is pertinent. Right? If it's let's say you're an orthopedic case, right? If you're talking to them about something else outside of their realm, they may not really care, because you're calling the wrong person. You're interrupting their precious time.
But as a person, we all make mistakes, and I think we all need to, no matter where you're at, you are responsible for yourself. You are responsible of how you're going to react, and whether somebody reacts poorly to you, you can still react well to them, and they're going to have to deal with how they've reacted. So we've touched on this a little. Maybe we'll dive into this on another episode down the road, because I think it's interesting to me, communication, but that's just a little tidbit that we wanted to give you today on Rethink Healthcare. So we'll see you next time.
Sounds good.